Cool, now we're going to talk about the second fascinating muscle of the upper arm, and that is the triceps muscle. This, as the name implies, 3 heads, and the 3 heads are all proximal. They all come down and they join into one big strong tendon which runs across. So the 3 heads are fairly, the way I think of them is that there are 2 heads which attach to the humerus. One attaches on the outside, which is the lateral head, and the other attaches on the inside of the humerus, and that's the medial head. So if we take the lateral head, it attaches quite close to the end of the humerus, just about there, just below where the deltoid muscle comes in, here, and then it runs down from its attachment, runs down, wraps around, and joins into the big tendon, which is the tendon that's the extender of the elbow, like that. The second is the medial, which attaches inside here, and it forms the, you can't really see it because it's tucked behind, so it's tucked in here, and then wraps around like this, and joins into the tendon. So you can see how they both wrap around, coming into this big tendon, and the bulk of the muscle is from the long head. And the long head attaches here, here's your scapula, and the long head attaches to the scapula. Quite a big, broad attachment, runs down, spreads out, covers over, especially the medial head, and it comes down and joins directly in. So all of these muscles together will extend the elbow, but the long head runs across 2 joints again. So that's why this is very complicated stuff. And when the long head contracts, it will actually slightly adduct and extend the shoulder. Again, a stabilizer of the shoulder and an extender of the elbow. Now, there are triggers that occur in all 3 of these heads. The triggers in the long head, which are the most interesting triggers and which occur the most commonly, tend to occur fairly proximally. So they're up here in the arm, and these triggers refer, the medial trigger refers where it is, it refers a bit proximally, and it refers down to the elbow, to the point of the elbow. The lateral trigger refers in a band up over the back of the shoulder, and here again it refers down over the lateral epicondyle. So now we have a second cause. Remember that the lateral brachialis refers out to this part of the elbow, the tennis elbow point. So does the lateral trigger point in the long head of the triceps refer down into that area. The lateral head and the medial head both have triggers lower down, and they refer pain where they are and down into the point of the elbow. So this is not an uncommon place for pain to present, and all too often people are looking for arthritis in the elbow joint, because as the olecranon process moves up and down over the head of the humerus, this is an area where you can get wear and tear and injury, but these triggers are actually quite a potent cause of pain in this area. The treatment, well, first ischemic pressure. So to find the triggers, you, as the lateral head comes round, you can compress it directly onto the humerus. As the medial head comes round, again, you can compress it directly on, or you can do a small little squeeze. These are best found by holding the muscle between your fingers and doing a mixture of a squeeze and a push here, like that, or squeezing the muscle between your fingers. You can find it either way, and one way is easier in some people, the other way is easier in others. Once you find the trigger, you stabilize it. So here I'm pushing down a bit, but I've tucked my finger under, and there, that's a bit tender. And as I press onto it, I'm pressing onto this finger underneath. I find the trigger, and then I use ischemic principles that we've described before. Finding the point, reducing the pressure, then gradually increasing it, staying below the pain threshold. Now, the next treatment is cold and hot, and the use again the principles from the origin over the trigger, down into the insertion and into the pain zone. And so sometimes the pain zone actually extends higher. So I would start up here, you're over the pain zone, over the origin, coming down either into the olecranon or over the lateral epicondyle. If you are not using a firm but a softer cold pack, you can actually wrap it round and bring it through like that. You do 2 or 3. So to stretch the muscle, again, first principles, you flex at the elbow, which will stretch the medial and the lateral parts of the triceps. But this muscle, which is an adductor and an extender, you need to stretch in this way. So that is the stretch of the triceps. And you can see that. You can see as you lift up, you can see how the long head becomes stretched. And again, in this position, start from the origin, run over, 2 or 3 runs, then rest down, place heat on the whole muscle. Once it's nice and hot, repeat the stretch. Very good.